Chapter 9, Nail Structure and Growth. Please open your text to page 197. Why nail study and growth? On page 198, let's begin on distinguishing the structure of the natural nail. Please highlight, a natural nail, known as the onyx, is a hard protective plate composed mainly of keratin, the fiber-shaped protein around the skin and hair. End of highlighting. The keratin in natural nails is harder than the keratin in skin or hair. The natural nail is located at the end of the finger or toe. It is an appendage of the skin and part of the system, which is made up of the skin and its various organs. Nail plates protect the tips of the fingers and toes, and their appearance can reflect general health of the body. A normal, healthy nail is firm but flexible. The surface is shiny, smooth, and unspotted with no wavy ridges, pits, or splits. A healthy nail is also whitish and translucent in appearance, with the pinkish color in the nail bed showing just below. In some races, the nail bed may even have more of a yellow tone. The water content of the nail varies accordingly to the relative humidity of the surrounding environment. In a humid environment, nails contain more water. Please highlight. A healthy nail may look dry and hard, but its water content is actually between 15 and 25%. Please continue highlighting. The water content directly affects the nail's flexibility. End of highlighting. The lower the water content, the more rigid the nail becomes. Using an oil-based nail conditioner or nail polish coat to plate can reduce water loss, prevent excessive absorption, and also improve flexibility. Moving on to page 199. In this area, you're going to learn how to identify the nail anatomy and describe the 9 basic parts of the nail unit. Please highlight. The natural nail unit is composed of several major parts, including the nail bed, nail matrix, nail plate, nail cuticle, epiconium, periconium, hypoconium, specialized ligaments, and also nail folds. You'll see on figure 9-1 on the bottom part of page 199 the actual diagram of your nail unit. Let's begin highlighting your nail plate. Please highlight. The nail plate is a hardened keratin plate that sits and covers on the nail bed. It's most visible and functional part of the nail unit. End of highlighting. The nail plate is relatively porous and will allow water to pass through much more easily and through normal skin of equal thickness. As it grows, the nail plate slowly slides across the nail bed. The nail bed is formed of a bunch of matrix cells. The sole job of the matrix cells is to create nail plate cells. Please highlight. The nail plate may appear to be one solid piece. However, it is actually constructed of about 100 layers of nail cells. Please continue highlighting. The free edge is part of the nail plate that extends over the tip of the finger or toe. Let's move to nail bed. Please highlight. The nail bed is the portion of living skin that supports the nail plate as it grows towards the free edge. End of highlighting. Because it's richly supplied with blood vessels, the nail bed has a pinkish appearance from the luna to the area just before the free edge of the nail. Please highlight. The nail bed contains many nerves and is attached to the nail plate by a thin layer of tissue called the bed epithelium. And a highlighting. The bed epithelium helps guide that nail plate along the nail bed as it grows. As a professional, you should understand the difference and also use the proper names and parts of the nail unit. For example, the nail polish is applied to the nail plate, not the nail bed. Let's move to page 200. The matrix. The matrix is an area, please highlight. The matrix is an area where the nail plate cells are formed. Continue highlighting. It is composed of the matrix cells that produce the nail plate cells. End of highlighting. The matrix area contains nerves, lymph, and blood vessels to nourish the matrix cells. As long as it's nourished and healthy, the matrix will continue to create new nail plate cells. The matrix extends from under the nail fold at the base of the nail plate. Please highlight. The visible part of the matrix that extends from underneath the living skin is called the luna. Continue highlighting. It's the whitish half-moon shape underneath the base of the nail. End of highlighting. The whitish color is caused by the reflection of light of the surface and the visible part of the underlying matrix. The lighter color of the luna shows the true color of the matrix. Every nail has a luna, but please know some lunas are short and remain hidden underneath your epitonium. Growth and appearance of the nails can be affected if an individual is in poor health, or if a nail disorder or disease is present, or if there's been an injury to the matrix. The cuticle. Please highlight. The cuticle is a dead, colorless tissue attached to the natural nail plate. End of highlighting. The cuticle comes from the underside of the skin that lies above the natural nail plate. The tissue sticks tight to the nail plate and can be super difficult to remove. Its job is to seal the space between the natural nail plate and the living skin above the epitonium, to prevent the entry of foreign material, microorganisms, and to help avoid injury and infection. Sometimes the names for professional nail products are pretty confusing. To avoid this problem, always know the proper names and the various parts of the nail unit. Always pay close attention to what product is actually designed to do. For example, look at products marked as nail cuticle moisturizers, softeners, or conditioners. You know, the cuticle, it's dead skin on the nail plate. So why are these products designed to moisturize, soften, and condition the cuticle? It honestly makes no sense. Cuticle moisturizers, softeners, conditioners are actually designed for the epitonium, lateral sidewalls, and hypotonium, not for the cuticle. Cuticle removers, now they are properly named. They remove dead cuticle. These professional products can quickly dissolve tissue, and when carefully applied to the nail plate, they speed up the removal of stubborn cuticle tissue. Misunderstandings about the correct names on the parts of the nail cause a great deal of confusion, so make sure you use these terms and use them properly. Let's move on to your epitonium. Please highlight. Your epitonium is the living skin at the base of the natural nail plate covering the matrix area. The epitonium is often mistaken for the cuticle. End of highlighting. They are not the same. The cuticle is dead tissue that's adhered to the nail plate. In other words, the epitonium is the living tissue that grows up onto the nail plate. The cuticle comes from the underside of this area, where it completely detaches from the epitonium and strongly attaches to the new growth plate. It pulls free to form a seal between the natural nail plate and the epitonium. Many people cannot tell the difference between the nail cuticle and the epitonium, but it's an easy way you can use this simple checklist. Ask the following questions. Is the tissue adhering directly to the natural nail plate, but it can be removed with gentle scraping? Is the tissue very thin and colorless, but easily visible under close inspection? Please highlight this question. Is the tissue non-living and not directly attached to the living skin? End of highlighting. If you answered yes to any of these questions above, then the tissue is called a cuticle. Please star this. Now let's ask these three questions. Is the tissue part of the skin that grows up to the base of the natural nail plate? Is the tissue any part of the skin that covers the nail matrix and luna? If you cut deeply into this tissue, will it bleed? If you answered yes to any one of these questions above, the tissue is called the epitonium. Cosmetologists are permitted to gently push back the epitonium. But please know this, as a cosmetologist, you are prohibited from cutting or trimming any part of the epitonium because it is living skin. Cutting living skin is outside the scope of a cosmetologist and is never ever allowed under any conditions or circumstances. Let's move farther down on page 201 to the peritoneum. Please highlight the peritoneum, as shown on figure 9-1 on page 199, is the living skin bordering the root and sides of the fingernail or toenail. The hypotonium. Please highlight the hypotonium is a slightly thickened layer of skin under the nail that lies between the fingertip and the free edge of the nail plate, and a highlighting. What its job is to form a protective barrier that prevents microorganisms from invading and infecting your nail bed. Your specialized ligaments. Please highlight. A ligament is a tough band of fibrous tissues that connects bones or holds an organ in place, and a highlighting. Specialized ligaments attach to the nail bed and matrix to the underlying bone. These ligaments are located at the base of the matrix and around the edges of the nail bed. Lastly, nail folds. Please highlight. The nail folds are folds of normal skin that surround the nail plate. These folds form the nail groove or furrow, please star furrow, on each side of the nail. Continue highlighting. The sidewall is also known as the lateral nail fold, a fold of skin overlapping the side of the nail. Let's move on to page 202. We're going to discuss and learn how an actual nail grows. In Chapter 7, Skin Structure, Growth and Nutrition, you learn that nutrition, exercise, and a person's general health affects the health of the skin. These factors the growth and health of the nail plate as well. A normal nail grows forward from the matrix and extends over the tip of the finger. Normally, healthy nails can grow in a variety of shapes, depending on the shape of the matrix. The length, width, and curvature of the matrix determine the thickness, width, and curvature of your natural nail plate. For example, a larger matrix produces a thicker nail plate, and a highly curved matrix creates a highly curved free edge. No product or procedure can make the nail plate grow thicker because a thicker nail plate requires a larger matrix. Please highlight. The average rate of a nail plate growth in a normal adult is about 1/10 to 1/8, or 2.5 millimeters to 3 millimeters per month, and a highlighting. But many factors affect this growth rate. Age, for example, affects the nail growth compared to nails of an average adult to child's nail growth. Childs grow more rapidly, while elderly adults, they grow at a slower rate. Please highlight. Seasons also affect nail growth rate. Nails grow faster in the summer than they do in the winter, and a highlighting. Pregnancy can dramatically affect the nail growth because of hormonal changes in the body. Nail growth rates increase dramatically during the last trimester of your pregnancy. The nail growth rate increases and decreases quickly after the delivery of the pregnancy. The baby. And then they return back to normal, as do hormone levels for the body. Always know it's a myth that nail growth rate is increased by taking prenatal vitamins. Nail growth rates will only accelerate when a woman is pregnant and not when she takes these vitamins. A nail's position on the body also affects the growth rate. Please highlight. Nail growth rate is the fastest on the nail in the middle finger and slowest on your thumb. Toenails grow more slowly than fingernails, and a highlighting. Although toenail plates grow more slowly than fingernail plates, They are thicker because the toenail matrix is longer than the matrix found on the fingertips. Below on figure 9-2, you can see a variety of nail shapes. Let's move to page 203. Please highlight. If the nail is abnormal in shape or form, it is called a nail malformation, and a highlighting. This can be a temporary or permanent condition caused by disease, injury, or infection that has affected the matrix. In this case, it can change the shape or the thickness of the nail plate, and it could appear altered or deformed. In fact, these conditions of the nail plate In fact, these conditions are generally the only reason a person should shed the natural nail. Healthy nails do not shed automatically or periodically in the way that a healthy hair is shed. Please highlight. Ordinarily, replacement of a natural fingernail takes about 4 to 6 months. Please highlight. Toenails take about 9 months to a year to be fully replaced, and a highlighting. The nail matrix is constantly creating new nail cells. Each time a new nail cell is created, it pushes the previously created cells upward and away from the matrix. This causes a plate to flow slowly towards the free edge, but only as quickly as the new cells are produced. If a small portion in the nail matrix stops making new cells, the nail plate will become thinner and develop a narrow groove. As a person ages, parts of the nail matrix will begin to permanently slow down production, causing the plate to develop a series of narrow grooves running along the length of the plate. This is considered to be a normal part of the aging process. Often these grooves are mistaken for ridges. The matrix does not grow any ridges on the nail plate, only grooves. And filing those so-called ridges will only thin and weaken the entire nail plate. Please highlight. Often after a disease, injury, or infection has occurred, the natural nail will return to its healthy growth as long as the matrix is healthy and undamaged. You will learn more about the nail plate malformation and common disorders in this next chapter, and a highlighting. Please know your nails. Many cosmetologists are interested in nails because of the creative opportunities it presents. As with every other area of cosmetology, this creativity must be grounded in full awareness of the structure of the nails and the surrounding tissue. Working on strong, healthy nails can be a pleasure. Remember that as a licensed cosmetologist, and you're allowed to work on only healthy hands and skin with no visible signs of disease and infection. Let's turn to page 204. Please know, you need to complete your review questions. Utilize your study guide and complete, and reinforce all your material with that study guide and your exam review book. We'll see you in class tomorrow morning to do your review prep in class.